Good morning, Titandales. I am Mihiraa. Let's start the warm-up sessions. Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating and am equally comfortable working alone.
Would you say you're a team player?
Yes, I'm definitely a team player. I enjoy working collaboratively and value the diverse perspectives that come from a team. Brainstorming with colleagues often sparks new ideas and helps us find the best solutions. However, I'm also highly self-motivated and can effectively manage my own workload and deadlines when working independently.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
Your preparation time is over. You can now start the role play.
Good morning, I'm Titan, one of the nurses here. Could you please confirm the reason for your child's visit today?
Good morning, nurse. Emily's here for wax removal.
Thank you for the confirmation, Mihiraa. How are you both feeling today?
Well, she's been saying that it feels like her ears are blocked. Sometimes she even complains of a ringing sound, and she hasn't been hearing the TV properly. I'm concerned that it might be an ear infection rather than earwax.
I completely understand your concern, Mihiraa. That must be quite worrying for you. Symptoms like a blocked feeling or ringing in the ears can indeed be distressing, but they are often due to earwax buildup rather than an infection. Has Emily had earwax removal before?
Yes, I've tried to clean her ears myself, but I was worried about hurting her. I've read that it's best to leave it to the professionals.
That was a wise decision, Mihiraa. The ears are delicate, and it's always safer to have a professional handle earwax removal. We're here to ensure Emily is comfortable and well taken care of. Let me explain the procedure to you both, so you know exactly what to expect. We use a gentle suction device to carefully remove the earwax, and in some cases, we might use a warm water irrigation technique. Both methods are generally quick and well tolerated by children. Emily might feel a little discomfort or a sensation of fullness in her ears during the procedure, and there's a slight chance she might feel a bit dizzy afterwards. I'll be right here with you to make sure she feels safe and supported. It's also important for you to stay with her during the procedure to offer comfort.
Well, Nurse Titan, is it really necessary to remove the earwax?
That's a great question, Mihiraa. Removing the earwax is important because a buildup can lead to hearing difficulties, tinnitus, which is the ringing sound Emily described, and even discomfort or earaches. Clearing the earwax can significantly improve her hearing and overall comfort.
I see. That makes sense.
Have you been using the ear drops with Emily as prescribed?
Yes, I've been using the olive oil drops as instructed to help soften the earwax.
That's perfect, Mihiraa. Using the drops helps soften the earwax, making the removal process smoother and less uncomfortable for Emily. It's great that you've been diligent with the drops.
That's a relief to hear. By the way, nurse, will all the earwax be removed today?
I understand your concerns, Mihiraa, and I truly empathize with your hope for a quick resolution. However, it's important to keep in mind that predicting the exact outcome of today's procedure isn't something I can do. Each case is unique, and the amount of earwax we can remove can vary greatly from one person to another. What I can assure you is that we will do everything possible to make Emily comfortable and to remove as much of the wax as we safely can today. The doctor will then assess the situation and decide on the best course of action moving forward. While I can't provide a prognosis, please know that you're in good hands.
I understand. I'm just hoping Emily feels better afterward.
I'm sure she will, Mihiraa. If we aren't able to remove all of Emily's earwax today, don't worry, Mihiraa. Sometimes, especially if the wax has hardened or is deeply lodged, it might take more than one session to clear it entirely. In such cases, the doctor might recommend scheduling a follow-up appointment. This will allow us to monitor Emily's progress and complete the removal if needed. In the meantime, it's important to continue using the ear drops as instructed. The drops help to further soften the remaining earwax, making it easier to remove during the next visit. Rest assured, we'll guide you every step of the way, and our priority is Emily's comfort and hearing health.
Thank you for explaining everything so clearly. I think Emily is feeling a little more relaxed now.
That's wonderful to hear. It's so important for Emily to feel at ease. Before we proceed, I just need to get your consent for the earwax removal. Do you understand the procedure, Mihiraa, And do you give your consent for Emily to have it done today?
Yes, I understand, and I consent to Emily having her earwax removed.
Thank you, Mihiraa. I'll let the doctor know we're ready to begin. We'll take good care of Emily.